Hello everyone. So I'll be discussing to you the circulatory system. So of course we all know that our circulatory system is mainly composed of blood vessels. What are the functions of these blood vessels? Of course, first, it carries the blood. It also functions as an exchange in nutrients, waste products, gases within tissues, transport of substances, and it also regulates blood pressure and it directs blood flow to the tissues. Okay, so there are three types of blood vessels. First, you have your arteries. Your arteries carry blood away from the heart, and it is thick with a lot of elasticity. Okay. Next is your veins that carry blood towards the heart. It is also thick but with less elasticity. And then you have your capillaries, which is where exchange occurs between the blood and the tissue fluids. Okay, so si arteries, siya yung nagke-carry ng blood papalayo sa heart. Okay, from the heart papunta sa systems of the body. And then si veins naman, siya yung nagke-carry ng blood from your body systems pabalik sa heart. Okay, si capillaries, doon nag-occur yung exchange ng blood and tissue fluids. Let's go over with the structures of your blood vessels. As we can see in the picture, there is an arteriole and a venule. So, an arteriole is a small branch of an artery that leads to capillaries. And a venule is a very small vein that collects blood from the capillaries. So, these blood vessels have their walls, or let's say layers. First, you have your tunica intima, or the innermost layer. So, your tunica intima is composed of simple squamous cells. Okay? Siya yung pinakaloob, innermost layer. That's why it's intima. It's inside. And then, you also have your tunica media. From the term media, it's the middle layer. And it is composed of smooth muscle with elastin and collagen. And then, finally, you have your tunica adventitia or tunica externa. From the term externa, it is the outermost layer of your blood vessel. Okay, it is composed of connective tissues. So you have three major walls or layer on your blood vessels. Your tunica intima, tunica media, and tunica adventitia or tunica externa. So this is the cross-section of the arterial and venous walls showing the different blood vessel layers. So how does our blood flow? Okay, first, of course, our blood flows from our arteries into the arterioles. So from a major artery, like for example, aorta, to the different part or different arteries from the body, and then going to arterioles or the small arteries, small branching arteries, and then into the capillaries. Arterioles into capillaries, and then from capillaries, exchange of blood and tissue fluids happen. It will pass through the venules, the small veins, and then from those veins, it returns to the heart through your inferior and superior vena cava. Next, let's go over the types of arteries. So you have elastic arteries and muscular arteries. For the elastic arteries, these are the largest in diameter and it has the thickest walls. And the best example of your elastic arteries are the aorta and pulmonary artery. Okay? For the muscular arteries, it is a medium to small in size. It's also thick in diameter, but unlike in elastic arteries, mas makapal yung walls niya. Okay? Si muscular, makapal siya but not as thick as the elastic arteries. Your muscular arteries contain smooth muscle cells, and it can control blood flow to your body regions. So, an example of your muscular arteries are your splenic artery and your hepatic artery. Next, you have your vasa vasorum, or also known as the vessels of the vessel. So this vasa vasorum is a network of small vessels, serves to provide blood supply and nourishment for your tunica externa or your tunica adventitia and to other parts of your tunica media. So it is usually found in large arteries, and it's said to be the reason for the development of atheromatous plaques. Okay? So when you say atheromatous plaques or atheroma, it is an abnormal accumulation of material in the inner layer of the artery. So this material consists mostly of your macrophage cells or debris like your lipids. Okay, so that's your atheromatous plaques. And then you have your nervi vasorum, from the term nervi, meaning it's a nerve. Okay, it is where both vasoconstriction and vasodilation are regulated in part by small vascular nerves. So when you say vasoconstriction, it's the narrowing of your blood vessels, and your vasodilation is the opposite. It's the widening of your blood vessels. Okay, so again, your nervi vasorum is also known as the nerves of the vessel. Okay, it runs within the walls of the blood vessels. So si vasa vasorum, siya yung vessel ng blood vessel na mismo. And then sa nervi vasorum, siya yung nerves ng vessel. Okay, so both are attached to our blood vessels, nervi and vasa vasorum. Okay? Next, we'll go over with the capillaries. Okay, so capillaries is where the blood flows from your arterioles into capillaries. Okay, so capillaries branch to form networks, and blood flow is regulated by smooth muscle cells called precapillary sphincters. So what are these precapillary sphincter? So it is a band of smooth muscle that adjusts blood flow into capillaries, mainly in the mesenteric microcirculation. And it is the point where each of the capillaries originates from an arteriole. Okay, so basically, yung nakikita nyo dun sa image, yung mga maliliit na parang nakadikit dun sa arterioles na parang dinikit na chewing gum, those are your precapillary sphincters. Okay, so that sphincter opens and closes. Okay, so if your sphincter closes, meaning there is enough oxygen in the tissue and the concentration of the nutrients are high enough, so no blood flow is needed, kaya siya nagsasara. But nag-open naman siya if kailangan nang mag-release ng carbon dioxide and yung concentration ng nutrients sa capillaries nyo ay mababa na. So your sphincter opens if the carbon dioxide needs to be released and if the concentration of nutrients are low. Okay? Next, you have your capillary bed. Okay, so here in the capillary bed, if all of the precapillary sphincters in a capillary bed are closed, blood will flow from the metarteriole directly into a thoroughfare channel and then into the venous circulation, bypassing the capillary bed entirely. Okay, so from the image on the left, makikita nyo dyan yung precapillary sphincter. Okay, sabi, kapag close yan, ibig sabihin, yung blood ay mag-flow galing dito sa metarteriole directly dun sa thoroughfare channel. Okay, so instead of passing through the capillary bed dito sa buong to, ay didiretso na siya dun sa thoroughfare channel. This thoroughfare channel connects the metarterial to the venule. Okay? So, this is your metarterial. Yang thoroughfare channel na yan yung nagko-connect papunta dun sa venule. So, it has capillaries around it. So, basically, your metarterial serves as a vascular shunt kapag sarado yung precapillary sphincters nyo. Okay, so your vascular shunt serves like a shortcut. Okay, if your precapillary sphincters are closed, ang gagawin ng metarterial, ibabypass niya yung capillary bed at didiretso siya kay thoroughfare channel para dumiretso kay venule. Okay, in addition, an anterior venous anastomosis may bypass the capillary bed and lead directly to the venous system. Okay, so this arteriovenous anastomosis is a direct connection between an artery and vein. Okay, as you can see in the picture, it serves as a backup routes for blood flow also if other blood vessels are blocked. Okay. Next, you have your types of capillaries. Okay, this one is according to their degree of leakiness. Okay, so kung paano nagdo-drain or lumalabas yung blood sa kanila. Okay, so first you have your continuous capillary. So this is the most common type of capillary, and it is found in almost all vascularized tissues and characterized by a complete endothelial lining with tight junctions between endothelial cells. Okay? Dito sa continuous capillary, siya yung unang-una sa picture. Okay? Siya yung most common type. Usually, continuous capillaries are the passage of molecules like water and ions. Okay? So, kaya siya most common, yung pinaka-common dun sa katawan natin, which is water and ions, dyan nagpapass kay continuous capillary. Okay? Next, you have your fenestrated capillary. So, it is one that has pores or fenestrations from the term fenestrated. So, in addition to tight junctions in the endothelial lining, this make the capillary permeable to small molecules. Okay? So, fenestrated, marami siyang pores, yung mga tuldok-tuldok na nakikita nyo, those are fenestrations. Okay? And it is a passage for small molecules and limited amount of proteins also. Okay? And then next you have your sinusoidal capillary. Okay, these are a special type of fenestrated capillary. They are flattened and they have extensive intercellular gaps and incomplete basement membranes. Very large openings allow for the passage of the large molecules, including plasma proteins and even cells. Okay, so dyan kay sinusoidal capillary, mostly passage of your blood molecules. Okay, it also includes your red blood cells, your white blood cells, and other plasma proteins. Okay, so those are your three types of capillaries. Next is the types of veins. So, from the capillaries, blood flows into venules, and then from venules, it flows into small veins. Okay, so veins have all three tunics, which are your tunica externa, tunica media, and tunica interna. Okay, so you have a medium-sized vein and a large vein. For your medium-sized veins, these veins usually collect blood from your small veins and delivers to your large veins. And then your large veins contains valves. Okay, so these valves are the one responsible in preventing blood from flowing backward. Okay, so si large veins lang yung merong valves. For you to be able to understand the comparison between arteries and veins, you may refer to this table. Okay, so for the direction of blood flow, for your arteries, it conducts blood away from the heart. For the veins, conducts blood towards the heart. Okay, as for general appearance, arteries are usually rounded and veins are irregular and often collapse. Okay, for the pressure, high pressure kay arteries, low pressure naman kay veins. Wall thickness, again, mas thick si arteries and mas thin naman si veins. Relative oxygen concentration, it's usually lower in the pulmonary arteries and higher in pulmonary veins. And then, of course, valves, there are no valves present in your arteries, but your veins have valves. Okay? Next, we'll go to circulation in the blood vessels. Okay, you have your pulmonary circulation, which carry blood from your right ventricle to the lungs and back from left atrium of the heart. And you also have your systemic circulation that carry blood from the left ventricle through the arteries to the different systems of the body. Okay, so basically, your pulmonary circulation carries the oxygenated blood and your systemic circulation carries oxygenated blood. Okay? So basically, from the term itself, pulmonary, it is related to your lungs. Okay? So meaning, the oxygenated blood pa siya going through your lungs. And then, for systemic circulation, from the term systemic, these are oxygenated blood going through your body systems. Okay? So, your pulmonary trunk is where blood pumps from your right ventricle towards the lungs. And then, your pulmonary veins carry the oxygen-rich blood to your left atrium. So, let's go over with the parts of aorta. So, of course, your aorta is the largest artery in the body. So, you have different parts in your aorta. First is your ascending. Okay, the ascending aorta, it passes superiorly from the left ventricle. Okay, as you can see in the picture, yung nasa left, that is your ascending aorta. And then you have the aortic arc. Okay, so this aortic arc has three major arteries which carry blood to the head and the upper limbs. Okay? And then you also have your descending aorta which extends through the thorax and abdomen to the pelvis. Your thoracic aorta is the part of the descending aorta that extends through the thorax to your diaphragm, and your abdominal aorta, descending aorta that extends from your diaphragm where it divides at the common iliac arteries. Okay? So these are the arteries of your head and neck. You have your brachiocephalic artery, which is the first branch of your aortic arc, and it supplies blood to the right side of the head and your neck. You have also your left common carotid artery. It supplies blood to the left side of the head and your neck. Okay, so brachiocephalic, right side, si left common carotid naman ay sa left side. And then you also have your left subclavian artery, which supplies blood to your upper limbs. Okay, yung tatlong yan, those are the branches of your aortic arc. Okay, yung sinabi ko kanina. Okay, so these images are available in your book. Okay, so your internal carotid arteries, by the way, supplies blood to your brain, and your external carotid artery supplies blood to your neck and face. Okay, so yung makikita nyo dyan sa image, sa previous page or sa previous slide, Yung internal carotid artery yung para sa brain natin, yung external naman yung para sa neck and face. Okay, so usually pag ginigilitan ng leeg, 'di ba? Usually agad-agad namamatay kasi if natamaan yung carotid arteries, okay, ang nagiging effect nun, nawawala ng supply ng blood sa brain natin. Kaya automatic patay. Okay? Next, you have your arteries of the upper limbs. You have different arteries. Of course, you have your axillary arteries, brachial arteries, ulnar arteries, and radial arteries. Okay? So, the summary of their functions are there. You also have the arteries of your abdominal aorta. You have your celiac trunk arteries, superior mesenteric arteries, inferior mesenteric arteries, renal arteries. So again, when you say superior and inferior, superior siya yung nasa taas, inferior yung nasa baba. Okay? Then you also have your hepatic arteries. From the term itself, hepatic. So it supplies blood to your liver. Okay? And then you have your testicular arteries. It supplies blood to your testes. Ovarian arteries to your ovaries. Inferior phrenic arteries. And lumbar arteries. Okay? Next, you have your arteries of the pelvis. You have your common iliac arteries. You have external iliac arteries and internal iliac arteries. Okay, so these arteries supply blood to your pelvic area. Okay. Next is the arteries of lower limbs. Okay, you have your femoral arteries. From the term femoral, it supplies blood to your thighs. Okay, dyan sa femur part nyo. Okay, you have your popliteal arteries to your knee, anterior and posterior arteries, and fibular arteries. Okay. Next, you have your veins. Your major or the biggest veins that we have in our body is the superior and inferior vena cava. Okay. So, your superior vena cava returns blood from your head, your neck, your thorax, and your upper limbs. Okay, it empties into the right atrium of the heart. Your inferior vena cava, since inferior siya, galing siya sa baba, it returns blood from your abdomen, your pelvis, and your lower limbs. And it empties into the right atrium of the heart also. Okay, so from the terms pa lang, you would know na what's their function. Okay, from the superior, syempre, ang nire-return niyang blood is coming from the upper part of your body. Inferior is from the lower part of the body. Okay? So, the veins of the head and neck, you have your external jugular vein, internal jugular vein, subclavian veins, and brachiocephalic veins. Okay, so, like your arteries, you have carotid arteries, internal and external carotid arteries. Sa veins naman, merong external and internal jugular vein. Okay? So, si internal jugular vein, siya yung nagdi-drain ng most blood from the brain. Okay? Si external jugular vein naman, ang function niya, siya yung nagdi-drain ng blood from the neck and face. Okay? So, si internal carotid artery, siya yung nagsusupply sa brain. Si internal jugular vein, siya yung nagde-drain naman sa brain ng blood. Okay? So, same with external jugular vein. Siya naman yung sa neck and face. Okay? Next, you have your veins of upper limbs. You have your brachial veins, cephalic veins, median cubital veins. Okay, so your median cubital veins connects to your cephalic vein that is near your elbow. Next is the veins of thorax. You have your right and left brachiocephalic veins, azygos veins. It drains blood from your thorax into your superior vena cava. Internal thoracic veins, posterior intercostal veins, and hemiazygos veins. Okay? So, next is the veins of your abdomen and pelvis. So, again, halos same lang din yung mga names niya kay artery. Pinagkaiba lang, there are veins. They are responsible in draining blood, okay, instead of supplying. So, common iliac vein, external iliac vein, internal iliac vein, and renal vein. Renal vein, from the term renal, it drains blood from your kidneys. Okay? And then, you also have your hepatic portal system. Okay, so this hepatic portal system is a vascular system that begins with capillaries in viscera and ends with capillaries in the liver. And it uses splenic vein and superior mesenteric vein. So remember that the liver is a major processing center for substances absorbed by intestinal tract. So nagpo-process siya ng products or substances galing sa intestines. So si hepatic portal system, siya yung nagpo-process ng mga nutrients na yon sa blood natin bago pa siya bumalik sa heart. Okay, so basically, after sa digestive system, yung mga nutrient molecules ay magpupunta dun sa hepatic portal vein or hepatic portal system dyan sa liver, and then ang gagawin ng liver, ipoprocess niya yung blood content bago siya bumalik sa inferior vena cava at bumalik sa heart. Next, you have the veins of the lower limbs. You have your femoral veins, great saphenous veins, popliteal veins. Okay, so si great saphenous veins, kaya siya natawag na great because it is the longest vein in the body. It runs along from your thighs to your foot. Ganun siya kahaba. That's why it's called great saphenous vein. Next, we'll go over with pressure. Okay, so for blood pressure, I will let you watch a video so you would understand how blood pressure works. Okay?
If you lined up all the blood vessels in your body, they'd be 95,000 kilometers long. And every day, they carry the equivalent of over 7,500 liters of blood, though that's actually the same 4 or 5 liters recycled over and over, delivering oxygen and precious nutrients like glucose and amino acids to the body's tissues. All that blood exerts a force on the muscular walls of the blood vessels. That force is called blood pressure, and it rises and falls with the phases of the heartbeat. It's highest during systole, when the heart contracts to force blood through the arteries. This is your systolic blood pressure. When the heart is at rest between beats, blood pressure falls to its lowest value, the diastolic pressure. A typical healthy individual produces a systolic pressure between 90 and 120 millimeters of mercury, and a diastolic pressure between 60 and 80. Taken together, a normal reading is a bit less than 120/80. The blood traverses the landscape of the body through the pipes of the circulatory system. In any plumbing system, several things can increase the force on the walls of the pipes: the properties of the fluid, extra fluid, or narrower pipes. So if the blood thickens, a higher pressure is needed to push it, so the heart will pump harder. A high salt diet will lead to a similar result. The salt promotes water retention, and the extra fluid increases the blood volume and blood pressure. And stress like the fight or flight response, releases hormones like epinephrine and norepinephrine that constrict key vessels, increasing the resistance to flow and raising the pressure upstream. Blood vessels can usually handle these fluctuations easily. Elastic fibers embedded in their walls make them resilient. But if your blood pressure regularly rises above about 140/90, what we call hypertension, and it stays there, it can cause serious problems. That's because the extra strain on the arterial wall can produce small tears. When the injured tissue swells up, substances that respond to the inflammation, like white blood cells, collect around the tears. Fat and cholesterol floating in the blood latch on too, eventually building up to form a plaque that stiffens and thickens the inner arterial wall. This condition is called atherosclerosis, and it can have dangerous consequences. If the plaque ruptures, a blood clot forms on top of the tear, clogging the already narrowed pipe. If the clot is big enough, it can completely block the flow of oxygen and nutrients to cells downstream. In vessels that feed the heart, that will cause a heart attack when oxygen-deprived cardiac muscle cells start to die. If the clot cuts off blood flow to the brain, it causes a stroke. Dangerously clogged blood vessels can be widened by a procedure called an angioplasty. There, doctors thread a wire through the vessel to the obstructed site, and then pass a deflated balloon catheter over the wire. When the balloon is inflated, it forces the passageway open again. Sometimes a rigid tube called a stent is placed in the vessel to help hold it open, letting the blood flow freely to replenish the oxygen-starved cells downstream. Staying flexible under pressure is a tough job for arteries. The fluid they pump is composed of substances that can get sticky and clog them, and your typical healthy heart beats about 70 times a minute, and at least 2.5 billion times during an average lifetime. That may sound like an insurmountable amount of pressure, but don't worry, your arteries are well suited for the challenge.
Next will be the clinical correlation. So, the effects of aging on blood vessels. Of course, there are a few effects if we're getting older sa ating blood vessels. Number one is that reduced elasticity and thickening of arterial walls that results in hypertension and decreased ability to respond changes in blood pressure. Okay, so as we grow older, as we age, of course, we also deteriorate not only outside but also inside. Okay, and that includes our blood vessels. Atherosclerosis in an age-related condition, of course, is usually an effect of aging on blood vessels. The efficiency of capillary exchange decreases with age, and the walls of veins thicken in some areas and dilate in others. For the most common disease of the blood vessel is your atherosclerosis. So this disease builds up plaque inside the arteries. Okay, so this plaque is made up of fat, cholesterol, of course, calcium, and other substances that can be found in the blood. So over time, plaque hardens and narrows your arteries. Okay, dun sa nakita nyo sa video, sa blood pressure. So kapag may atherosclerosis ka or ang blood vessels ng isang tao, tendency is nabablock niya yung blood flow. Okay, so instead of having a normal blood flow, luminipis or naboblock yung lumiliit yung daanan ng blood, preventing normal blood flow sa blood vessels natin. Okay, so that's what you call atherosclerosis. Then you also have your thrombosis and embolism. Okay, so your thrombosis occurs when a thrombus or a blood clot develops in a blood vessel and reduces the flow of blood through the vessel. While an embolism occurs when a piece of a blood clot or foreign object or other bodily substance becomes stuck in a blood vessel and largely obstructs the flow of blood. So basically, si thrombosis, it's like an atherosclerosis, but kay thrombosis naman, blood clot yung nagde-develop. Okay? Unlike kay atherosclerosis na may plaque na nagbe-build up. Kay thrombosis, blood clot naman. Sa embolism naman, ang nangyayari, yung embolus or yung piece of clot, na-stuck siya dun sa blood vessel. Okay, so either a blood clot or a foreign object na na-stuck sa blood vessel. Okay, so that's the difference of your thrombosis and embolism. Next is varicose vein. Okay, so this is the most common type of disease in our blood vessels. Okay, so nowadays, even younger people and younger generations are having this varicose vein. Okay, so there are a few types of varicose veins. First, you have your spider veins, also known as telangiectasias. So these are usually color pink or red, sometimes purple in appearance, and it causes discomfort. Okay, so yung spider veins yung maliliit na veins. Okay, yung super niliit niya. And then you also have reticular veins. They are usually green to blue, sometimes also purple in appearance, and it usually causes burning and itching. Okay, sometimes it has this burning sensation and makati siya. Okay, those are your reticular veins. They are associated with spider veins also, but reticular veins are called these feeder veins. Okay, so usually si reticular veins ay nagiging cause ng weak or damaged valves ng veins natin. Remember that our veins have valves to prevent backflow of blood. Okay, so kapag may reticular veins ka, ibig sabihin you have a damaged valve, okay, in your vein. And then we have the most common, and yun talagang sinasabi nilang varicose veins. Okay, so these are usually dark blue to purple, and it usually causes pain. Kaya ito yung pinaka-common sa mga matatanda na sobrang laki, na sobrang sakit din, ganon. These varicose veins can bulge out above the surface of the skin, yung malalaki na nakaumbok na sa balat ng mga matatanda, ganyan. Usually, these varicose veins occur sa mga kapag masyado ng mabigat or if we're already overweight, tapos due to pressure na binubuhat ng legs natin, kaya nagkakaroon tayo ng varicose veins sa paa. So, there are risk factors kung bakit nagkakaroon ng mga varicose vein. First, you have family history. Okay, kung nasa lahi nyo na laging nagkakaroon ng mga varicose veins. Okay, previous trauma or injury that can damage veins. Gender can play a role, as women are twice as likely to develop the condition than men. Why women? Because women are the ones who get pregnant. Okay? Remember, when a woman is pregnant, di ba mas mabigat yung weight niya kapag buntis? So usually yung pressure ay mataas, no? So, usually nagkakaroon ng varicose veins. Okay? Medications such as birth control and infertility drugs that can increase estrogen and progesterone. That's another thing kung bakit mas nagkakaroon ang mga babae ng varicose veins. Okay? So, pregnancy can put pressure on a woman's pelvic area and veins. Yan yung sinabi ko rin kanina. Obesity or being overweight. Okay? Prolonged standing or long periods of immobility can increase pressure on the veins. Okay, so all of this, most of this actually involves pressure. Okay, so mas less yung pressure, mas less yung risk ng pagkakaroon ng varicose vein. Okay? And lastly, you have hemorrhoids, or layman's term, in Tagalog, yung almoranas. Okay? These are also known as piles. These are swollen veins in the lower part of the anus and rectum. When the walls of these vessels are stretched, they become irritated. Although hemorrhoids can be unpleasant and painful, they are easily treated and very preventable. So, meron namang mga nabibiling ointment na para sa mga hemorrhoids, no? And usually, isa sa mga nagiging dahilan kung bakit nagkakaroon ng almoranas ay yung pagpilit sa pagdumi. Okay, syempre binibigyan natin ng pressure yung puwet natin na ilabas yung hindi niya pa gustong ilabas. Okay, kapag pinipilit mong umire, ganon, nagkakaroon ka ng hemorrhoids. Okay, that's one of the most common causes of hemorrhoids. And again, hindi naman siya ganun kadelikado kasi madali naman siyang magamot. Okay? May mga topical ointments na pwede kayong ilagay para matanggal siya or mawala. Okay? So, that ends your circulatory system. If you have any questions, don't hesitate to message me. Thank you.